Hello everyone, sorry about that. Welcome to the webinar series today. This is a special one we have here today. We're coming live from the Brisbane Convention and Exhibition Centre. It's about 5:30 in the afternoon and we're here today with some special guests. We're looking at a special edition this time on the Navigators Trial. My name's Marie Montgomery and this webinar series is one in many of the series that we are conducting in regards to navigating my aged care. I'd like to acknowledge the great work of CODA and the Navigators Trial, and also this is funded by the Australian Government. I am from OPAN, the Older Persons Advocacy Network, and here today we've got Laura Casey. Hi, and Laura is a program manager for the older people at Brisbane South Primary Health Network. That's quite a mouthful.
Yeah, it is.
Thank you for coming. And Rebecca Daniloff. Hi, thank you. A manager of advocacy here at ADA Australia in Queensland, and you do an amazing job. So thank you both for coming. These ladies have been at a conference all day, so we're pretty weary. But we're quite spirited, so thank you. Now, a little bit of homework. I just would like to say, up in the top right-hand corner, you'll find a Q&A button. Please get on board, send us your questions. We can answer them live here. I have some Brains Trust as well hidden on the peripheries over this side, so they can help us. There is no captioning. I do apologise for that. This is a live stream to you today. And unfortunately, my lovely dulcet tones can't be captured by the computer. Just a few other little things. We have a Facebook group. This group is growing at rates and leaps and bounds, we should say. And we are putting on the links to the webinar, what we discuss, any of the sites that we will show you. We've had great communications happening through this Facebook site, so it's Facebook, OPAN. Down the left-hand side, you'll find groups. The group's called Navigators, and please join us. And if you send us any messages, we can answer questions through that. Alrighty, let's come across to these lovely ladies on my left. So, Rebecca, I'm going to go to yourself first. Tell us a little bit, I guess, about your background, what brings you here, but most importantly, why are you so passionate about aged care and the Navigators Trial?
My background's in disability.
Uh-huh.
So, yeah, it's being really keen to look at how disability and then aged care kind of intersect, and it's been really interesting to get that kind of information, particularly as our people with disabilities are getting older and older, and it's looking at what options are out there for them. So my background's very strongly disability, but also really interested in looking at what aged care has to offer people. The Navigator, I guess, has been a good opportunity for us to really think outside of what we normally do in our core business. And it's allowing us to reach out to people who we wouldn't normally get an opportunity to talk to.
Yeah, and that's the beauty I find of this trial, that we're sort of looking outside the box. We're trying to find some innovative ways in either community or information and education, because this whole webinar series is part of that trial as well. So excellent. Now, you're a speech pathologist in the past.
I am a speech pathologist.
And like public speaking, I believe. I did a little bit of research. So it's excellent because you looked at communication tools, etc.
Part of my work as a speech pathologist has always been about advocating for people to have voice, particularly people who have difficulties with communication and may need alternate means for communication, whether they're young or whether they're old, whether they use high tech or low tech. So I think that leads itself nicely into advocacy as well.
Absolutely. It leads it beautifully into advocacy, because that's exactly what it's about, isn't it?
Yeah.
Empowering and assisting.
Absolutely.
Yeah. Excellent. Thank you. Laura, what about yourself?
So I have an allied health background as well. So my background's in nutrition. I've been with the PHN for about 7 years. So I worked in a number of different spaces there, whether that's chronic disease, allied health, working with the primary care workforce. So now in the older people's space, we have this great opportunity to do things like the Aged Care Navigator trials. And for us, it's been something that we've been hearing from our community members for quite a while, that they're really struggling with navigating the system, and so is the sector and the health professionals as well. So it's a great opportunity to be able to help with that connection and make a difference.
Yeah, perfect. See, perfect candidates for today's webinar. So you brought up, Laura, a really good point there. Navigating the My Aged Care system can be quite convoluted, and particularly we find people will come to crisis before they even access any services whatsoever. And part of this process is being prepared, being really financially prepared, but also aware of what services are in your area, what are assessments, what's an ACAT, step-by-step process, really pulling it apart. We're actually next week looking at the interpreter service and what they can do, and also we've got people coming as well for the called groups as well. So it's really a practical webinar series. Beautiful. But today is the Navigators Trial. So the Navigators Trial overall is a consortium of 31 consumer-focused groups. So do you want to tell me a little bit more about the actual overall trial? What is the Navigators Trial?
So the trial it's quite interesting, and it is a trial, and that's what we have to keep reminding ourselves and everyone else. And it's really about testing. What are good supports? What's the best way to assist people to get the information that they need? So for us, it's always going back to, this is a trial. This gives us the opportunity to do things that we wouldn't normally do, and see what might work, and also give ourselves, I guess, that ability to fail and go, no, that was wrong. Let's learn from that.
And that's it. Let's learn from that. Yeah, excellent.
So the Navigator has a few different arms in what it's trialling. So there's community hubs, there's information hubs, and there's specialist workers. So all slightly different, all with the same goal of helping people navigate the system.
Okay.
So the community hubs, of which I'm not involved in, but PHN is a peer-based model. We're involved in the information hub, so that's a paid worker. Some of our advocates are involved in providing support and information to people. And then there's a specialist worker role, so there's 6 of those across Australia.
Okay, and this is across Australia, isn't it?
It is, and it's been interesting just to start hearing what's happening in other locations as well. So that it's all quite new for us. So it'll be interesting as the trial progresses to see what's working, how many people we're able to support.
Okay, fantastic. So there are 62, if I may say so, trials happening across Australia in every state and territory to identify what types of supports achieve the best outcomes for older Australians. Excellent. So your particular hub is the community hub.
We actually have a mix of all three, so we're in a pretty unique position, which is nice. So we're the only primary health network that's part of the consortium, and we've been awarded 6 trials, which is just fantastic. So we've got 3 information hubs, 2 community hubs, and a specialist support worker position.
Are you in manager of all of those? Wow, that is a huge role, because I know just being a project manager of one research unit, it can be crazy. So
so we think that it's been a challenge, but it's been a great one. And we're in that position that we're able to integrate the different types of hubs and navigator models. So we think that we're in a good position to be able to learn from that and see how they work and talk to each other. So the way we've done it in our area is have a place-based approach. So we found through our needs assessment and our data the areas that had higher needs, more older people, multicultural backgrounds, Aboriginal and Torres Strait Islander people. So we've set up 2 information and community hubs combined. So in the Cleveland area, we have a community centre that's working with both paid workers and volunteers, and a similar model in Logan, and a community centre out of there as well. So that's information and community hubs combined. We have a full-time specialist support worker that sits at the PHN. So she's available across our whole region, working with all the different trials, and mainly going out and visiting people in their homes. And then we have the mobile information hub, which ADA Australia is doing, so reaching all those other locations.
Okay. So how far, this I'm not from Queensland and I'm a bit naive. So we say we're Brisbane now, so you're Brisbane South going Bundaberg way, is that correct?
No.
Going up that far? No? Right.
No. So Brisbane South, we're south of the river.
Yep.
So we go not as far down as the Gold Coast.
Okay.
So we follow the same boundaries as, if people know, the hospital and health services, so Metro South Health.
Okay.
Yeah.
All right. Good. So, okay. So, excuse me. It's very...
We are in Bundaberg.
One of you were.
So we're our office is based in Bundaberg, and we are supporting the Wide Bay area.
Okay.
So that includes Harvey Bay, Maryborough, Gin, so the local localities around there. It's probably an hour drive.
All right.
In any direction.
Beautiful.
Hour and a half. Yeah.
So did you get to choose your regions, areas, or whatever? You mentioned you were awarded this particular trial. So were they set up beforehand?
Yeah. I think it was a very deliberate strategy to look at the mix of trials across the state, to look at metro versus regional, more regional, which is why Wide Bay was pulled out particularly. So there was quite strategic, I believe, in the locations.
Our area is very diverse, so we've got a lot of multicultural backgrounds, a lot of Aboriginal and Torres Strait Islanders. So
excellent, good. Alrighty, so who was the Navigators Trial instigated by initially? So Coda.
Yeah, well, the funding was available through the Department of Health, so that tender came out.
Yeah, the questions that people have been asking us. So
right.
I've just got to tease it apart.
Okay. And there was a report that came out in 2017 by David Choon, and there was some recommendations in there about the need for navigators.
Yes.
And the need for, increasing awareness about my aged care and using the website and that sort of thing. So I'm guessing from that, the government identified that there was a need to provide some funding there, and that was open for tender. So Coda Australia pulled together their consortium partners, and
so that was launched by the minister at the time. So Ken Wyatt looked at that as part of his initiative.
Fantastic, great initiative, really, for Australia-wide. That's just amazing, isn't it? Great strategy. All right, beautiful. So you've talked about community information and specialists hubs. Now, for those out there that don't work in aged care or don't work in the industry at all and are consumers of aged care services, we can talk the talk, you know what I mean, sometimes. But if we teased each of them apart and said, okay, these are the 5 things that community aim to do, these are the 5 things that, say, the information hub tends to do, what would you ladies say that the main aims of each of those would be?
So in the Bundaberg area, we're actually working with the other partner who has a community hub, so that we're trying to cover the whole region. So whether it's by them using volunteers who are trusted members of the community already, and we're coming in with a paid worker. So together we're trying to cover the whole of Bundaberg to provide that support to people. So we're looking at different ways of achieving that. So it might be through a seminar, it might be through a group. We're trying some pop-up stands as well. So we might be in the library or a shopping centre. So just trying to be with the general community might be. So not particularly going into an aged care facility or anything like that. It's that step before. So reaching out to those people or their families who might need to think about aged care support in the future.
Right. And it's about being prepared and letting that information out there and utilisation. So pop-ups, great idea. I love the idea. So how have you found your audience? Like, are people engaged? Are they asking you sort of, why are you there? What are you, what's it about?
It's definitely a learning experience for us to make sure we're popping up in the right places.
It's not easy, is it?
It's not. We've had a lot of success with the neighbourhood centre. So the neighbourhood centre, particularly in Bundaberg, is really well connected to the local community and is able to steer us in good directions. So we've been to a spectacles clinic where people are just there anyway, so a bit of a captive market for us. And we have tried the supermarkets, but probably need to tweak that a little bit more to make sure that we're there at the right times for people as well, and that we don't look like we're selling something as well. So we don't want to put people off by that as well. So there's a few different things for us to consider to make ourselves accessible and for people to want to come up and ask us questions. Also, there's, I guess, sometimes some of that barriers. People say, I'm too young, I'm not ready to think about that yet. And so we need to look at how we present information. So it's not about you're going in this direction now. It's just, here's some information. Here's how you can find it should you need it.
Absolutely.
Yeah.
It's so the language and the way we present this is also very, very important, isn't it? Yeah. Otherwise, we're not going to get engagement and not achieve what the trials actually want.
Yeah.
Absolutely.
Yeah.
Do you have anything there to add to that? You know, to tease out what your hubs like, a practical idea of what you may be doing at Brisbane South.
Mm-hmm. Well, I can't talk directly because I'm not actually out there in the community delivering them, but I can give a very broad overview and my understanding of it, how it's all going. Very similar to what Beck said, the information and community hubs are delivering seminars which have been really well attended. They've also been doing sort of smaller groups, so that opportunity for questions and answers and one-on-one supports for people.
Okay, so say for instance the seminar, what would be the title of the seminar, just to really tease that out and to give the people out there an idea of what we're you know, the topics, etc.
Yeah, the seminars we've been running in our area at the moment have been very broadly just about the aged care system and what is my aged care, what type of home supports can you access, who's eligible, how to go about that, directing them to the website, showing them through how you would actually do that, and just very sort of broad brush, sort of that first entry level into knowing a bit more about the aged care system. So we're finding that people are going to these information seminars but then coming back to the community centres for those smaller groups or one-on-one supports for their individual situations.
Are you finding there's huge need out there?
Yeah, we are. We were looking at our numbers the other day, actually, and across all our trials, just in 2 months, we'd reached about 770 people through the different trials. So we're really excited to see that. And
because, as you said, 3 months, you've really been kicked off only ever for 3 months. So that is a really good number. And like even these webinars, we're actually getting 400 to 500 people register for the webinars, and our turnaround promo sometimes is only a couple of days. So, there's a big need for information and I think assistance in navigating aged care. All right, now, it's a bit hard to hold the mic and take a question, but we've got a question from Adam. What is the extent of what a specialist support worker can do? Are they able to help me register? And I register with my aged care, I'm assuming. Thanks, Adam.
Yep. So our specialist support worker, her role is to get people into the point that they've commenced their services. So Marion is our specialist support worker in the Brisbane South region, and she's able to support people, with whether it's filling in forms, speaking on behalf of them with My Aged Care. It might be going through different options for them and helping them to choose what. So she can definitely support with going through the application processes.
Great.
And part of the information hub is that we're not only providing group support, but we also can do individual support as well. So we can do similar work to the specialist worker in helping people through those steps.
Fantastic.
So our specialist support worker is for the more complex people. So our information and community hubs are for people that might not have really complex situations or complex medical needs or that sort of thing, whereas the specialist support worker is more for somebody that might have a little bit more complexity in their life. So they might be a bit more socially isolated. They might be from a non-English speaking background. They might have a disability. There's a whole range of vulnerable groups that we are trying to reach out through that trial.
Fantastic. No, it's just great. It's great, isn't it? Great. I just get so excited by this stuff because I just think it's so important that we really look at how we can assist people navigating aged care. And there are services out there and there are amazing people out there doing some great work as well. Fantastic. Right. Oh, I think we've got some more Q&A, so this is good. So, sorry, George, I'm trying to manipulate a few things here, George. Oops, and there it goes again. So, George, will using a specialist support worker speed up the process? You'd have to just look at their faces, George.
Certainly, if you want to get everything together to apply, it might help you. But in terms of the process, bit
The
like
process
that
is the
as well.
process. Yeah.
But, you know, having somebody there, or they may be going on to an advocacy support service who might be able to just support you and make sure that all, you know, everything's covered and that as much as possible has been done. If your circumstances have changed, then perhaps it can help with updating those circumstances. So, but at the end of the day, unfortunately, we're bound by what the government can provide.
Absolutely,
Yeah.
absolutely. And I think the best advice that we're probably giving everyone across this webinar series is be prepared before you even need aged care services. Have those financial and legal things in place, understand My Aged Care, or have a look at the site. And there's some great websites that are put out by governmental bodies. I knew the New South Wales one, Get It in Black and White, we looked at last week. It was really informational. I'm sure they have the same here in Queensland. So yeah, absolutely. Actually, on that particular note, are there any areas besides your fantastic services that you provide locally that you would recommend people looking at being prepared? Now, I've put you on the spot.
I think just being familiar with the My Aged Care website is probably a good start. We work with CODA quite a bit in terms of their support of different people. They're probably the main ones. But certainly contacting us and letting us know your particular circumstances, we can put you in touch with who might be, you know, a good service or organisation to support your particular needs.
Absolutely. And again, yes, contact your advocacy services in your state. I think that's where you're going to get a great informational hub as well. And I've got one more. No, not one more, sorry. Alrighty, so I think we're near the end, ladies. So you're a wealth of information, both of you. Are there any findings yet? I know you've only been going for 3 months. Are there any things that you've found, or is there any anecdotal evidence that's coming through, or anything that you feel that actually some of the trials that you're doing are going to work and are going to find, you know, an area or a cohort that we can assist better? Yeah.
Well, a big part of the trials is collecting data. So information and community hubs have at the end of their activities, so whether that's an information seminar or a one-on-one support, are going through their evaluation forms. So I know to date that there has been increases in people's confidence using the system, their knowledge, their understanding. There's a wealth of data that's been collected at a national level. So it'll be really interesting as we sort of move forward in the trial to see the summaries of those and see what's happening. In terms of on the ground, I know that everyone that has reached out and been part of the activities have found it really valuable. People have been, less confused, I suppose, and more able to go ahead and make those decisions, whether that's right now at this point or in the future.
So empowering people. Yeah, I think if we give people the skills, obviously they're going to do a lot better. Yeah.
I think, as Laura said, there's a lot of data collection, and some of the interesting trends already that have come out is around different age groups that are accessing the Navigators. So that's quite interesting to see when people might want to access those services. And at the moment, it's quite interesting in that it's probably younger in terms of the 60 to 65-year-old demographic, and then it jumps to 85 to 90-year-olds. So I guess we're just waiting to see, you know, the data as it comes through and that again will inform us as to who we should be reaching out to give that information. Yeah.
Wonderful. Well, thank you, ladies, so much for being with us today. You are a wealth of information and you're doing some great work, and I really appreciate your time. I know how busy you are.
No worries.
And, hang on, I've got the nod from the secret Tom over here, the guru guy. Anonymous question. Do Navigators provide case management to assist older people to look at aged care homes and services?
So our worker can support some of that.
Yeah.
our advocacy as well, the OPAN network and other advocacy services as well, can support people to give them the options, to show them a way. So we're independent, we're not funded by any particular aged care service, so we're independent.
Yep.
We can give advice, we can give people the range of options. We won't make that decision, but at least people can feel that they're fully informed to make a good choice.
Great. Great, thank you. All right, so that's us for the day. Don't forget to tune in next week. We've got a triple webinar happening on Wednesday the 24th where we're going to actually have guests from My Aged Care. We're going to do a simulated My Aged Care registration. Yeah, very practical. We'll have...
we've done some of those with some of the local libraries. So it's trying to kind of cross over the Navigator with some tech skills.
Yeah.
So that's been really good.
Excellent. There you go. We're right on the same page. That's fantastic. So I thank you for tuning in today. Thank you, ladies, again, and see you all on Wednesday. Bye-bye.